Okay, I got you. So we're just getting started on the right shoulder. It was very unstable as we expected. As we get our first look inside, we can see several things immediately. Here's your biceps tendon on the left of that switching stick. As we look down at the biceps anchor, it's clearly loose. This is what we call a type 2 slap lesion. And that instability or that detachment of the labrum carries around all the way into this what we call a Bankart lesion from the recurrent dislocation. So the good news is it does not look like you've lost a lot of bone, but you've certainly got this chronic Bankart injury in the front. Now, as we look towards the rotator cuff tendon looks good, some fraying but no significant tearing. And then as we look towards the back of the shoulder, we can see some posterior labral tearing there. And then here's our Hill-Sachs lesion on the humeral head. And that's the reason why we're also going to be adding a procedure that we call a Remplissage so that we can get this fixed up for you. So the next step is we're going to go ahead and switch positions with the scope and put in 2 anchors into the humeral head. Okay, so here's a look at this humeral head. Now we're looking from the front, and we're going to use this rasp just to roughen up this Hill-Sachs defect here. So we're just using this just to remove some of the kind of calcified cartilage here. I'll show you some more in a little bit. Okay, here we've got the first anchor in the bone. You can see when we pull on it how it brings the whole humeral head back over the glenoid. Okay, here's our second anchor. We're probably not going to want or be able to use all 3 of these sutures, so we're going to start with the black and white one first. Okay, you can see how we've organized that third suture. It's going to also close the posterior portal once we tie it, but we're not going to tie it yet. We're going to work in the front of the shoulder next. So next we'll take our rasp. We can even use these to retract a little bit gently. No, don't. And we'll go ahead and free up the front of the shoulder. So you'll see the rasp come in here, and now we're going to work down the front so we can free this up and reconstruct the front. Okay, we're just using this rasp, has these sharp points on it, just to roughen up the capsule, and in particular right now, the inferior glenohumeral ligament here. You can see we've got an anchor in good position, and in a minute we'll get underneath this labrum and make our first stitch. Okay, so here's our suturing device. It's loaded with that same black wire we used for the work we did at the beginning of the case for the Remplissage. So we're going to start here, we're going to rotate back, and then we'll do a little bit of a shift by starting even a little bit more inferior. Okay, there's the first one passed and tied. We're going to place another one now. We've probably got 2 more to place before we get to the slap repair. Okay, what you see there is the third suture in the front, and that looks pretty good. We're going to go ahead and put the camera in the back now and have a look at this slap lesion. Okay, so you had this big detachment of the biceps. We've got it repaired. And as we look down the front, you can see the first anchor from the Bankart right there. Okay, and so this is all, looks pretty stable now. Hopefully that'll do the trick. We're going to go ahead and switch the camera one final time to the back, to the front, so that we can tie those Remplissage sutures. Okay, so we finished tying the sutures in the back of the shoulder. You can see how that's brought everything together. We've even organized the sutures so that it closed down that posterior portal, and that looks real good. So we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.